Our Station 5, Physical Wellness promotes proper care of our bodies. For optimal health and functioning, it encourages cardiovascular flexibility and strength, and also encourages the balance of nutrition and physical activity, and discourages us use of tobacco, drugs, excessive alcohol consumption. Healthy heart, healthy families. Okay, let's hear from Dr. Lee.
Oh, I see. Okay, I'd like to welcome everybody. At least we all know everyone. And the only new person, we have June. And June is the husband of Rosa. Okay, and so he helped us put together the computer, our computer presentation. So we're happy to have him. And then, of course, I'll introduce our speaker, Joanne Thomason, and she's the health educator for the breast cancer detection program, or the Every Woman Counts. And so I would just say that I think we already had spiritual wellness, we had mental health, behavioral wellness, we have social wellness, and now we have the fourth one, which is physical wellness, which is, I think most of us know a lot about physical wellness. And so we will start with the, the four major chronic diseases that afflict Filipino Americans. The number one is cancer. And for women, it's breast cancer. And for men, it's prostate cancer. So, I mean, later, we might have a session for men on prostate cancer. But today, we're going to have breast cancer. And then the second cause of death is heart disease. The third one is stroke. And so we have, heart disease also. After we finish the breast cancer, we have a heart disease with Rosa. Rosa, of course, she's a nurse and our MPH intern. And so next week, we are going to talk about diabetes. And this is the fourth common major cause of death in Filipino Americans. Most of us have diabetes. I have diabetes, you know. It runs in our families, and most of us have. So we also have another speaker. She is a nurse who is very active with the PNA, the Philippine Nurses Association of San Diego. And we are also going to have a dietitian, Yolanda Nampi, who is going to talk about dietary guidelines. So be sure to, invite other people, because I have emailed so many people, but unless it's personal, you know, that a lot of people really, unless you call them or tell, oh, let's go, you know how Filipinos are, let's go as a friend, then, they won't come. So, so try, the email is not enough, the letter, all the advertisement in the newspaper, unless we call them, I say, and invite them, personally, because what we are talking about is really so important. And I'd like to say also, that Sim Silverio, who is with the Asian Journal, he is putting this, he will put all these sessions in the Facebook under Asian Journal and Kalusugan. And we also have tapes, the CDs of all the sessions here. So if you miss something, the sessions that we will have that. So next time also, we when we do this again next year, we will have all those tapes. We will have the articles that I write also. Remember, I'm also writing this in the Asian Journal. So make sure you pick up an Asian Journal today, because I think the one I have is on social wellness. So if you forget or something, you can always get a copy of the Asian Journal, so you can look at it. Yeah. So if you have any questions,
So my question is, how do we advertise or invite people to come?
yeah.
Introduce. Let's hear from Joanne Thomason.
Hi everyone, I'm the health educator for the Every Woman Counts program. We are a breast and cervical cancer prevention and early screening program. Our program exists through the California Department of Healthcare Services. As Ophelia mentioned, we did recruit Faye to work as our Filipino community health worker, which is great because there's a huge Filipino population and we didn't have one before. I just started just a year ago, so I've been trying to actively recruit and get to know the different communities and their different needs.
So,
Alright, great. So, like I mentioned earlier, I'm from the Every Woman Counts program. So, part of our program, the reason why we exist is because we really encourage prevention and early screening. So, getting screened early and as recommended by doctors, and hopefully, that will reduce the amount of women who get breast and cervical cancer and the amount of women who pass away from it. So we're all about reducing those numbers. Yeah, so we're all about reducing those numbers. So our program, we include, we provide women with free mammograms, clinical breast exams, HPV tests, pap smear, and pelvic exam. So it's 5 different exams. And we'll talk about the eligibility for the program later on. So what is cancer? Cancer is a disease that occurs when cells in the body change and grow out of control. So we have a lot of cells in our body, in different parts of our body. So what happens is, the cells are constantly changing and, replenishing themselves. So where cancer comes from, it's those cells that mutate, and then these mutated cells keep replicating themselves. So these replicated, mutated cells end up becoming tumors. And tumors can become cancerous or they can be non-cancerous. Alright, so the anatomy of the breast. Most breast cancers occur in the milk glands over here, and then in the milk ducts right here. All right. So, breast cancer is the most commonly diagnosed cancer amongst women in California and overall in the U.S. Amongst Asian women, it is the most commonly diagnosed cancer amongst women, especially Filipino women. All right. So, Filipino women have the highest mortality amongst other Asian women of breast cancer.
Wow.
Yeah.
Why? Do you have any idea why?
Why?
Well, it's different factors.
Okay.
Yeah, it's a lot of different factors.
Yeah.
So I have a list of different factors. So it's late stage diagnosis. So a lot of Filipino women, they'll go and get screenings later on when breast cancer has developed into a later stage. So there's 4 different stages, 1, 2, 3, and 4. And then there's the low rates of compliance to screening. So they don't go the 1 to 2 years as recommended. And then, there's also other factors such as lack of medical access, fear of cancer, cultural factors, concerns over the cost of treatment for cancer, transportation. They feel like their time is being inconvenienced by these exams. There's an embarrassment, and they feel like there isn't really a need for the screening. So those are the different factors for the women. So it's really a combination of all of these. Okay, so what are some risk factors for breast cancer? Hereditary? What else?
Being overweight or obese.
Yeah, being overweight or obese. Stress. Okay. So, the 2 main risk factors for breast cancer are being a woman and getting older, being 50 plus. So, being a woman, because 99 out of 100 people approximately diagnosed with breast cancer are women. So, about 1 out of 100 are men. Because both men and women have breast tissue, so you're at risk just by having breast tissue. And then getting older, so about 78% of people diagnosed with breast cancer are women over the age of 50. Okay, so there's other risk factors that we talked about a couple moments ago. So there's that family history. If you have a mom, a daughter, or a sister that's had breast cancer, that increase your risk. There's personal history. So if you've had breast cancer in one breast, that increases your risk of having it in the other breast as well. There's a lack of physical activity, and then being overweight or obese. So all of those increase your risk. And there's also alcohol and smoking tobacco increase your risk as well. All right. So we encourage women to know breast self-awareness. So our program and doctors don't recommend self-breast exams anymore, just because some women, they'll do the self-breast exam and they don't know that the breast tissue starts here, goes up to here, and then it goes over here. So a lot of women don't know that. They'll just touch this area and that's it. So they're not covering all the areas with breast tissue. And then they might not know how to properly do it either. So it's important to, go to a doctor and just, be familiar with your own breast. So if there's anything that you feel that isn't normal with your breast, so if there's sudden dimpling, sudden discharge, if one nipple becomes inverted, so those are all different things. If there's discoloration around the breast. Those are all different things. So we told women, know your breasts. Okay, so one of the ways that doctors can find breast cancer early is with the clinical breast exam. So what they do is they have the woman undressed from the waist up and then lay her down with her hands over her head, and they're just going to go around in a circular motion, all around the breast tissue. So up here, over here, this area, and then down here near the rib cage. And then they also recommend that women also get mammograms. Sometimes when they do clinical breast exams, if the tumor is too small, the cancer is too small, they might miss it with the clinical breast exam. So they recommend getting the mammogram as well. And a mammogram is just an x-ray of the breast. We recommend one way for it to be slightly more comfortable is for women to go either 2 weeks before or after they menstruate, just because the breasts are the most tender around menstruation. Alright, so this is an example of a cancer cell that they're able to find with the mammogram that they didn't catch with the clinical breast exam. So it's important to do both together.
Yeah, I had breast cancer 6 years ago, and I had a small one. It wasn't detected by my doctor, but mammogram caught it.
Yeah, so that's why it's important to do both. You know, it's a safety precaution. Okay, so the recommendations now are that women starting at the age of 40 should go every 1 to 2 years. So it's important for a woman to find a health practitioner or doctor or nurse that she trusts and that she feels comfortable talking to about her body. A lot of women feel really uncomfortable talking about their bodies. So, you know, it's important to find that doctor that you trust that you can talk to about that, and then, you know, come to an agreement for how often you want to go, because it's really a personal choice. Some women prefer to go every year. Some women prefer to go every 2 years. Our program will pay for a woman to go every year if she wants to. And if she does have a family history, so a mom, a sister, or daughter that had breast cancer, you know, then it's recommended that they go before the age of 40. So even though our program doesn't pay for women to go under the age of 40, we do work with other programs that assist women under 40 with that family history of getting screened early, just because that is important. So this is examples of different breast cancer lump sizes that they found. So the size, they found it as big as the size of a plum, and then as small as a blueberry. So a lot of women, they ask, you know, what does cancer feel like? What does it feel like? And we tell them a lot of times, you know, in the early stages, it doesn't feel like anything. So that's why it's important to get screened early. You know, if you feel something when you have cancer, it's a bad thing, because it usually means it's progressed to a later stage.
Is that the biggest, the plum size?
That's big.
I don't know if it's the biggest that they found, but they found one the size of plum before.
Oh my
Mhm.
God.
That's
Yeah.
big.
Yeah.
That's
Yeah.
And I had an aunt that started with one, and then quickly she went to 4.
Yeah, it could develop pretty rapidly. Breast cancer can develop pretty rapidly. There's been cases where there's this woman who got a mammogram, and 5 months later, she ended up having breast cancer. So that was a pretty quick development. Everybody's body is different. You know, that's why it's important to go talk to a
I
doctor.
cannot see the sizes. The blueberry, what size is it?
It's the smallest
It's
one.
1 centimeter.
The
cm.
blueberry.
Mhm.
And
Raspberry.
raspberry is
Very
2.
small.
Mhm.
Okay.
Grape is 3. 4 and 5.
That's why they say early detection
Yeah.
is the key.
Yeah, it's important. My sister is prone to ovarian cysts, and she had a cyst the size of grapefruit in her ovaries, and she had no idea. She had no idea. So, you know, some
honey,
people,
just push it back.
some people, you know, you just don't know. I mean, it seems really big, but it's not like she felt anything when she had that.
Once you have it removed, will it come back?
Yes.
There's a chance, yeah, after treatment that it can come back.
So you do the mammogram again? every
Yeah, that's
time?
why it's important to still go get it.
Yeah.
You know, some women, they'll go once and that's it. They won't go for the rest of their life. But, you know, it's
Shit,
important. Your
yeah,
body
yeah.
changes.
Yeah.
Yeah.
Yeah. So, real quick, let's talk about the myths of breast cancer. So, a lot of people don't know what causes breast cancer. No one knows what causes it. We just know the risk factors. That's why we talk about prevention and getting screened early, because no one knows what causes breast cancer yet. So there's different myths that go around about what causes breast cancer. So a lot of women think injury to the breast can cause breast cancer later on in life. So getting in a car accident and then having injury to the breast, which is a common one, and then getting a soccer ball or basketball to the breast when they're younger or something, then they'll get breast cancer later on. Or one woman told me burnt toast. So, like a lot of people have different myths about what causes breast cancer, but just realize that they don't know what causes breast cancer yet. And they're still trying to figure that out, unfortunately. Okay. So, let's see. What if a person is diagnosed with breast cancer? So there's a program, another program through the state of California. They're like our sister program. It's called the Breast and Cervical Cancer Treatment Program. And if a woman is diagnosed with breast or cervical cancer, she could call this 1-800 number, or she could ask about the program through our program. We're really familiar with it. And they do treatment for women in California, so they help them with getting treatment, connecting them to different resources in the community, different breast cancer resources. So there's a lot of programs in San Diego that really help a woman if she has breast cancer. So there's programs where, they help with your rent, just because most likely you aren't going to be able to work. You don't have that energy to work. There's programs that will cook your meals and things like that. And they try to make it as nutritious as possible, because if you have cancer, they want you to eat healthy. And they'll cook the meals not only for you, but for your family as well. So there's a lot of support in the community, different programs.
Is that the 1-800 number?
Yeah, this is the 1-800 number for the
There's the 1-800.
yeah, for the breast and cervical cancer treatment program.
Is that only for the low-income women? I mean,
No, it's not only for low-income women.
so anybody without health insurance or something?
I don't think this one's just for low-income women. Our program is for low-income women, but I think this program, other women can qualify for it.
Oh, I see.
Yeah, I don't think you have to be low-income for that one.
I see. Okay.
Yeah.
Because if you have health insurance, your doctor, would be able to treat you, right, for the breast cancer.
Well, with people's insurance coverage varies. So, a lot of women, their health insurance, depending on what it is and their coverage, it won't cover everything. So this program kind of tries to alleviate that. Yeah, with the treatment and everything. They help with, asking questions about finances and how to, support having cancer and that treatment. Yeah, but it is a program through Medi-Cal, so they really try to help,
Medi-Cal.
They really try to be mindful that cancer is expensive, so they try to help with it. And the program's for at least a year, and then after it ends, if you still need treatment or assistance, then I believe you could just reapply after a year for it.
I wonder how cost of diagnosis or treatment or is the one that causes people to have cancer. They're afraid of the cost. Do you know how large?
How much it can cost?
What's the percentage of the reason why it's costly? That's why they don't go.
Yeah.
I don't know what the percentage is exactly, but I know that's one of the factors for why they don't go and get the screenings, because they think, after I get the screenings, if they find something, it's going to be really expensive to treat that, and it's just going to be a lot of money, and people don't want to think about that. Yeah, so they just don't go to the screening in general, and it's a common perspective amongst underserved populations, so minority populations.
The cost of screening also is expensive, or it costs money.
Yeah,
for the
screenings can be expensive. That's one of the reasons why our program exists. So if a woman qualifies for it, then she gets free screenings. So there's no copayment, no deductible. And we'll talk about more of the qualifications after, because there could be some questions about it. But if a woman qualifies, she doesn't have to pay for anything.
But if you are in the middle class, you have to pay out of your pocket.
Yeah, unless you have insurance, and even then, if you have like a copay or deductible, it can be expensive.
So that's also a deterrent for people to have the screening. Maybe just,
Their copay
because
or
it's
deductible's too high.
expensive, it costs money, so we'll just postpone it.
Yeah,
Yeah.
because it could be expensive for.
But
a lot
now
of
with the Medicare, the preventive care, it's all free.
Yeah.
Yeah,
So
the screening and preventive care.
there's
If you have Medicare, it's free.
yeah, there's this law. I don't know if it's federal law, but it exists in California. It's called the Well Woman Act, where women are, if they request it, they should be getting, stuff like the mammograms for free. Like their insurance shouldn't charge a deductible, or I believe a copay either. Yeah, so that act is supposed to help assist women with getting those screenings.
Sometimes if you have medical insurance,
Mm.
it's they require the medical people require you to check it every year.
Mm.
Instead of you will be asked, they just require you to do that. Yeah.
Well, with the Affordable Care Act, preventive care is very important.
Mhm.
So now it's free for if you are with Medicare,
Mhm.
preventive care, which includes mammogram,
Yeah.
prostate screening for men, it's free. It's all part. It's
Yeah.
all part of the
Yeah,
the
Medicare
package.
and Medi-Cal, they
Yeah.
should be providing free breast and cervical
Yes,
screenings. And
yes.
then under that other act,
Mhm.
too, women should be getting breast and cervical screenings covered. And it shouldn't cost them anything.
Yeah, it's free. It's free.
Okay, any questions about breast cancer?
I have one question.
Mm.
Regarding the 1-800 number that you
Mhm.
mentioned earlier, does it only pertains to breast cancer patients? How about other types of cancer?
That one's just for breast and cervical cancer. So California, they have different initiatives. So there's hotlines for people with lung cancer as well, because lung cancer is the second highest cancer amongst women in California. So there's one for lung cancer and then another one for colorectal cancer as
Yeah.
well. Yeah. So it just depends what initiative California is working on.
Yeah.
Okay.
You can call the American Cancer Society
Mhm.
because they would have all kinds of cancers.
Yeah, supportive
Yeah.
activities for
We also have a lot of publications, I would say. I think I talked to Joanne about it, which is in Tagalog. So about cancer, so if you're trying to spread a lot of, materials like the Lions Club, we have all sorts of publications in Tagalog relating to cancer.
It's not, if you go downtown, what they call that administrative building, they have a wellness program there too, so if you can call
Which
them.
one?
County supervisors.
Oh, the county,
Yeah,
the
they
county
have the-
Department of
they
Health
have
Because
Services.
I have a
services, yeah.
friend.
Yeah,
Yes.
they do have.
She really needs some
Yeah.
help.
Yeah.
But it's not breast cancer. It's a.
Oh, yeah, generally.
Yeah.
I would say the American Cancer Society.
Because I didn't know that there's a program that they offer supportive activities for those patients who's suffering from
Yeah.
cancer.
Yeah.
And I think that's a good one, especially for those people who cannot afford.
Yeah, for
Maybe
the,
in your new job, you can ask them. Yeah.
Yes,
Yeah.
I will.
It's,
Because, Georgia Sadler from UCSD, she's a doctor in outreach, and she's a friend of mine, worked with her for 20 years. At one point, she told me that it's the outreach that's really missing, education, information. So I think we have to be fairly active in sharing, educating.
Yeah.
And I remember she told me that
We're gonna ask
I'm trying to recruit more Asian Americans to work with me in the outreach, and I'm remembering I'm gonna call her through this and volunteer. Yeah, that's a missing link.
Yeah, let her know about the program. I have other community health workers as well. Besides Faye as our Filipino community health worker, I also have a Vietnamese community health worker, Cambodian community health worker, and I'm Laotian. So we try to, cover our bases and work with a lot of other Asian organizations as well. So I'm a free resource in the community. So, just share the information, even if they just want like flyers and things like that. So I'm gonna pass this around. It's just to protect yourself from breast cancer fact sheet. So it's really great. It just talks about cancer and then, mammograms, clinical breast exams, and a link to our website. So it's just very concise information about breast cancer. Okay. Any other questions?
Is that in Tagalog? Do they have Tagalog?
No, they only have that one in English, in Spanish, in Vietnamese. So those are the only three languages that they have it in. They actually, after the last time we met, they just translated this in Tagalog.
Oh, really?
Yeah. So if Faye wants this flip chart in Tagalog, then I could ask them to print it. But they have this now, so it's available electronically, which is nice.
Yeah.
They're trying to get more languages.
It would be useful if you could get the Filipino one.
Mm-hmm. I'll request them for it. Okay. So since we have a little time, I'm just going to talk about cervical cancer real quick. Right. So cervical cancer occurs over here in the cervix. The cervix is right above the vagina and below the uterus. Okay, so most cervical cancers occur over here in the exocervix. Yeah, it occurs over here in the exocervix where the vagina and the cervix meet. And what causes cervical cancer? What causes it?
Virus.
Alright, so the human papilloma virus, also known by its acronym HPV, so it's one of the most common sexually transmitted infections. They estimate that about 80% of people come into contact with it and have it at some point. And with HPV, usually there aren't any signs or symptoms of it. So there's two strains of HPV that cause most cervical cancers. It's HPV 16 and HPV 18. So the thing to know about cervical cancer is that there are over 100 different types of HPV. That's over 100 different types. And they usually categorize it into the low risk strain and the high risk strain. So the low risk are those HPV strains that are least likely to cause cervical cancer. And then there's those high risk strains like HPV 16 and 18 that are more likely to increase your risk of developing cervical cancer. So this is an example of normal cervical cells, and then abnormal cervical cells and cancer cells in the cervix. So usually if they find abnormal cells in the cervix, they're just going to go ahead and treat it right there. So this can include cryotherapy. So they'll try to freeze those cells off, or they'll scrape it out. It just depends. So the main risk factor for cervical cancer is an HPV infection that does not go away. So one of the key differences with cervical cancer is that it is a sexually transmitted infection. So even if you had a family member that had cervical cancer, that doesn't increase your risk or anything like that, whether it's a sister or mom or anything like that. That doesn't increase your risk personally. And with cervical cancer, it takes a longer time to develop into cancer. So they say about 5 to 10 years. Okay, so there's other risk factors for cervical cancer besides that HPV infection that won't go away. So it's not having regular pap and pelvic exams. If you and your partner have had sex with more than one person, and that's because the more sex you've had, the more exposure you've likely had to HPV. And then there's smoking, poor diet, and getting older. So
Getting older.
yeah. So once you
Everything
hit 30 years old, that increased your risk for cervical cancer. So that's when they start doing tests for HPV. And there's a preventative measure that they've been talking about over the last few years a lot, and that's the HPV shot. So Gardasil is one of the more popular ones. So that's one preventative measure. But they target it towards children as young as 9, so boys and girls as young as 9. Yeah, that's when they recommend it. And the reason why is because they want them to get the shot, before they've had any
Right.
exposure to HPV. So any sort of sexual intercourse, that's when they want them to have it, because that's the best way to prevent it.
Still young.
Yeah,
They're still young.
yeah, it's still very young, but that's the way that they recommend it. So it's a series of 3 shots. So you have your first shot, and then a month after it's another shot, and then 5 months later it's that 3rd shot.
Yeah. Do they have a vaccine already?
Yeah,
A
they
vaccine
do have a
for
vaccine.
HPV?
Yes,
They
they
is.
do. Actually, I'd like to add something to that regarding the HPV vaccine. As a nurse, I don't know. I think it's a more case-to-case basis out there. If you know your teenagers, if they're really gonna be sexually active in the long run. If not, I don't recommend it because when I did the research about HPV vaccine, it can also cause seizure.
Causes one.
Seizure.
Seizure.
Seizure, and we don't want those. So, as a side effect.
Yeah.
But that is according to research. But if you know, you can always take a risk to, for your children to have that vaccines as a preventive measure.
Yeah, there's different risk factors with everything, especially vaccines. Even with birth control, there's still risk factors, like heart attack and things like that. But the risk isn't big enough to where they would, encourage people to not get it. But there are risk factors, and they talk to you about it as well. And there's different, there's a law in effect where if the parents don't want the child to get it for whatever reason, the child can actually go and get it themselves without the parent.
After
Yeah.
18. After 18 years old.
Well, they can go and get it before 18 without parentals.
Actually, they still ask us to sign.
Oh,
If
really?
it is under age 18 because I refuse for my kids. I don't, as a nurse, I don't know. Probably if I know that they will become very sexually active, I might, but at this time, not yet.
Yeah. Well, it's just something that's recommended. So they recommend it starting at the age of 29, and then at 26, they don't recommend it anymore because they just assume that you've probably already had that sexual exposure. So, they don't think it's going to be as effective. So insurance and stuff like that, they won't pay for it after the age of 26. And in the state of California, they won't pay for it anymore starting at the age of 19. So you really have to get it
So
soon.
you start at the age of 13 then?
They're offering
Yeah,
it.
yeah, you
Yeah,
know what?
they're
13
offering
is
it.
sexually
They're
Yeah.
offering it that.
active
Yeah.
already.
Yeah,
That
and-
age range.
Scary.
Yeah, and a lot of
Scary.
parents, they have different reasons for not wanting their kids to get it because they think, oh, they're going to become sexually active as soon as they get it. But it's just a prevention.
It's a preventive measure.
It's just a preventative measure. So that's when they recommend it. Yeah. But it's a personal decision,
It's a
just like
personal
with anything.
decision.
It's your body.
It's your body.
Okay, so doctors can find cervical cancer with the Pap test and an HPV test.
What's the HPV test?
It's the
HPV test.
It's similar with the Pap test.
It's like the pap smear?
smear.
Yeah,
Oh,
yeah.
I see.
So they use a swab and they they just scrape around, and if it changes a different color. then
Oh,
it's
I see.
cancer.
Okay,
Yeah.
so it's faster, huh?
They
Than
usually
the pap
take two.
smear?
It's not faster.
No,
They do
not
it with the
fast.
Pap smear.
Yeah,
Yeah, yeah.
because I know the pap smear, don't they send it to the lab or something?
They
Yeah.
have to send
Yeah, well, the results are quicker usually, but they do it along with the Pap test. the
Yeah,
Pap smear.
when they do the pap smear, sometimes the doctor said, I'm going to do the
What's that?
HPV test too.
Mm.
It's the same,
Yeah, mhm.
they use the same stick.
Oh, no, different.
Oh, no, it's a different, yeah.
Because pap smear go that way and
Yeah.
go different lab.
Go
you know, I mean,
different.
All right, so the cervical cancer screenings, it has changed over the last few years. So now the recommendation is that women starting at the age of 21 get a Pap test every 3 years. So remember, it used to be every year as soon as you have sexual intercourse, but now it's every 3 years starting at the age of 21 if the results are normal. If they're not, then they will readjust your screening guidelines according to your body. Okay, and if those results are normal from the age of 21 to 29, starting at the age of 30, they're going to do a Pap test every 3 years or a Pap test and HPV test every 5 years.
after 5 years.
Mhm.
Is there that means that at age 65 you don't have to have a pap smear?
Well, they
don't
still.
Yeah, they don't recommend it anymore.
You are exempt.
Exempt.
Is there an age where you don't
gotta be
have to
exempt,
have a
yeah.
A
pap
lot
smear?
of doctors, they stop
Still-
doing it at 65, but
65.
some will still do
I
it
think
after
after
that.
65.
Yeah.
they
Yeah.
don't really recommend.
And also, like if you're not sexually active, too,
Yeah.
do you have to have a pap smear?
They still recommend it.
Even if,
Yeah, yeah,
yeah.
That's one way of
Yeah.
yeah. Because with HPV, remember, it takes a really long time to develop. So if you've been abstinent for 10 years,
Yes.
you know, it's still important just because it takes up to 10 years
Yes,
to
to get
develop.
that. I see.
Mm-hmm. Okay, so this is a cervical cancer cell. So this is normal cervical cancer cell, an unclear one, abnormal, and then cancerous. So as you can see, the abnormal looks really similar to the cancer cervical cell. So they usually just treat it.
Joanne, is this promoted in the schools, middle school?
HPV.
Yeah.
I don't know if they
Have
do
the
sex ed in
sex
middle school
education.
still, and if they talk about HPV in middle schools. When I was in middle school in San Diego, they did not. So I don't know if it's something that they include anymore. But family health centers, they're one of the clinics that we work with that do sex ed for teens. So they do these different sex ed classes with teens where the parents can bring their kids in and educate them about practicing safe sex and just being aware of the risks of HPV and things like that in the long run, not just the short term. So there's a lot of different programs like that. Should I pass around the HPV or the cervical cancer one?
No.
Okay. All right. So I have this sheet. It's a cervical cancer fact sheet. It's very similar to the breast cancer one. It just has some facts about cervical cancer. All right. So any questions about cervical cancer? Yeah. So thank you for letting me talk about cervical cancer. One of the reasons why I wanted to talk about it too is not only because it's a part of our program, but it's because breast and cervical cancer are two very preventative cancers amongst women in the state of California. And cervical cancer is the second most common cancer amongst Filipino women as well. So yeah, second. So these statistics might have varied a little, but it's still, a very big risk for Filipino women. So it's just something to be aware about.
Is your statistics correct?
Mm-hmm. Yeah, I got it from the cancer website. Yeah, the National Cancer website.
You're gonna give us some handouts on that? Is that?
Oh, this one? Oh no, I don't have the.
Okay.
I don't have the stats.
Oh, we don't.
I just have them written down. I can email them if you want me to.
Oh, that would be good.
Okay. I could do that. I could email Julia about the stats with the articles that it's attached to as well.
Because they're not brave enough to go see the doctor. Oh, nakakahiya.
Oh,
Well, you know,
really?
Yeah, oh yeah.
That's the whole problem
Yeah.
with our community sometimes. That's why they are afflicted more.
Oh, really?
Yeah.
Yeah, I think that's
Yeah.
what I heard.
And with with the older generation, just because even with a lot of different groups, they're raised in a time where you don't talk about your health or your body or anything like that.
Yeah.
So with my generation, we really had to make our moms or our grandmas and our aunts go and get those. So even now, I still have to call my mom and schedule those for her or make her go. So it's all. A lot of women, they just need that support. They need that friend or that daughter or that granddaughter, someone to really kind of, walk them through it and encourage them, help them. Yeah. So the Everyone Counts program, we offer free cervical screenings to qualified women starting at the age of 21, free breast screenings starting at the age of 40. We work with doctors in the neighborhood. So how our program works is we work with different community clinics all around, not just San Diego, but the entire state of California. So our program exists all over California if you have friends or family that may qualify. The great thing about working with these community clinics is that, they offer evening and weekend hours. So they try to be very flexible and accessible for women. And then there's services available in different languages as well. So they try to meet those language needs, Tagalog, Arabic, Chinese. They try to really meet all of those needs. And then transportation, they have acknowledged it as one of their issues. So there's a couple of programs working on getting transportation for women to their appointments and then to treatment as well. So Komen, right now, they're working with Uber, the ride share program, basically like taxi service. They're working with Uber to donate free rides to women. Yeah, so that's a new initiative that they're currently working on. So hopefully, that'll help a lot of women. And then the qualifications. So a woman can qualify for a program if she lives in the state of California. So she doesn't need a social security, so she can be undocumented. So a lot of the women that we work with right now are undocumented women, which is really great because undocumented women, they don't have access to Obamacare covered California. And then be at least 21 for the cervical screenings and at least 40 for the breast screenings. Have no insurance and no Medi-Cal, or have a high insurance deductible or co-payment and be low income. So if a woman has a high insurance deductible or high co-payment, whether that co-payment is $5 or $50, if that's too high for her and she meets the other qualifications like residence or living in California, meeting the age requirements and being low income, then she can participate in our program. Because if you're low income, that $5 or $50 can, that could be money for groceries or other essentials, things like that. And the clinics that we work with, they don't dictate how much is too much or anything like that.
Oh, that's good.
Yeah. Okay, so this is our website. It's the provider locator on our website. So one of the great things about the provider locator, I prefer it more than the phone because you can put in your 5-digit zip code and it'll tell you all of the nearby community clinics within a 5-mile radius. Or you could put in your exact address and then you could narrow down the distance or expand it. And then you could choose a language preference if you need a female provider, if you need evening hours, or if you need weekend hours. So we try to make it very easy to navigate as well. And the 1-800 number is different, the breast and cervical cancer treatment program number. But I have the brochures over here in Tagalog and in English. And then there's also an app. I don't have it, but if a woman wants to download it as a reminder, to go and get these screenings, whatever is helpful, please download it. It's a free app. And then there's Cover California. So because our program is through the state of California, they want us to just mention Cover California to women and men, and just let them know, if you qualify for it, please get Cover California because it's more comprehensive than our program. They do more than just breast and cervical screenings, which is what our program does. Okay? So, any questions about qualifications or anything like that? I know it can be a little confusing.
I have a question. I know you also do
That's
some
my
outreach
opinion.
program.
Mhm.
So, what is your technique? This is just out of fact. What is your technique? Is there any, how do you reach those target population? Do you use some statistical data where you know where are the people? Because it's hard to get all those people to attend the class.
Komen has a list of statistics and San Diego County has a list of statistics, but I think, I was born and raised in San Diego, so I kind of know which communities live in which areas more so than others. So I know if I'm doing something in Southeast San Diego, if I'm doing outreach there, I know I'm going to be reaching the underserved population over there, So, and I know if I'm doing an outreach at like the Filipino Sun Festival, I know I'm targeting that Filipino population. So it's really about knowing what events are going on and then really working with our community partners, whether it be the clinics, Komen, religious organizations, and just trying to be actively involved with them. Yeah. Yeah, they make it, they're really easy to work with, so they're really great. Okay. So, I'm going to pass around the post-test. It's almost the exact same as the pre-test. It's just kind of to see what you took away from the presentation. And thank you.
You don't have to take this ball.
Yeah,
Because you didn't take the pre-test. You didn't
Yeah,
take the
I
pre-test.
I had mine here. Thank you.
And
But
there's
maybe you
different
can
outreach
ask Ida
strategies
to,
too.
Yeah, I will.
Ida
You
to,
can be really creative with it now as well. If you guys want it, in case you want more information or the brochures that I passed around today and the flyers, those are all available electronically for free. So if you want those or statistics or anything like that, just shoot me an email and I'll be able to provide those for you as well.
yeah.
Business card.
Okay. Do you have any other question?
I have a question.
Yeah.
As I know most patients suffering from cancer is experiencing depression. Do you guys also offer some psychological care to those patients?
Our program, since it's
No.
just screening
Just
and
screening.
education, we don't. But you know, when they do the treatment program, they assist with not just the physical treatment of it, but also other aspects. So not just physical and the financial side of it, but they also try to, you know, work on the mental health as
Like
well.
a social
yeah,
coordination or collaboration
yeah.
with the social
yeah.
work.
And they'll usually try to, you know, one of the best ways that they do it is they connect them with a breast cancer support group in their area, and that really helps
Yeah.
having that. And there's a ton of groups in San Diego, a ton of different groups. So there's
Yeah.
definitely not a shortage of that. And then they help them if they want to talk to someone one-on-one as well. So just all those different resources. They do a pretty good job at it.
I think the American Cancer Society would, yeah, because they have a lot of programs. Maybe if in cancer, if you're losing your hair or something, they have, you know, they
Yeah.
have a program to
Like a support
help
group
you.
or
Yeah,
something?
they
have
have
you getting wigs.
plenty of those
Yeah.
programs.
Yeah.
And I think you know Demi West.
Demi.
Yes, she's one of our board members. And she works with the American Cancer Society. So you might want to ask her about, depression. You know,
Yeah,
if
depression.
they have a
Most of
program.
them.
But those support groups, you know.
Yeah, the support groups are great. They have
Yeah.
different things to try to, make women feel better. So
Yeah.
they have the programs for the wigs, and then they also have programs with like makeup and stuff like that.
Oh,
and
yeah,
they,
makeup.
there's a woman that was telling me she just coordinated, last year she coordinated a breast cancer survivor fashion show. So there's
Oh.
different things, you know, that to kind of bring up their mental health, but it's about also trying to connect all these different resources because they're available out there, you know, but it's making a lot of women aware.
Wellness, prevention of heart disease and stroke.
Yeah.
Okay.
Hi, everybody. I don't need to introduce myself. Everybody knows me. My name is Rosa Emperador. I'm an intern here under the service of our beloved CEO, Dr. Opilio Daniel. She asked me to talk about heart disease and stroke. And being probably the reason why she asked me this is because I work in a progressive care unit / telemetry in the hospital. I've been an RN for 27 years, and most of my lifetime, I take care of the patient who's undergoing heart surgery. So, just bear with me for about an hour or so, and then we will learn about this heart disease and stroke. Okay, hold on. I even make a little bit animation to, you know. Okay. Well, actually, I got this from my research. The heart attack, cancers, and stroke have been the major causes of death among the Filipinos. You will be amazed with what I got. There's about 9 people are diagnosed with cancer every hour, just like what Joanne was discussing earlier. There is about 61 people die of diabetes every day. I got this news from the Philippine newspaper, by the way. And there's 5 people died of respiratory disease, including the tuberculosis, every hour. And this is the most scary part. And there's about 276 Filipinos died of heart disease every day, and 1 person dies of a stroke every 9 minutes. So you will be quite surprised. How come? As a Filipino, it's 276 people died. What's the reason behind? So, is it our genetic makeup that make us predisposed to having heart condition? So we will find out as we go along.
Or diet.
I think it's our food. Okay. Oh, so I'm not going to discuss it more detailed. Ate told me, Rosa, don't use so many medical terms.
Yeah.
But as I go along, I'll tell you. You just tell me if I talk too much about medical, use too much. This is the heart. The most important thing that you need to find out right now, because I need to discuss to you the circulation of the heart. What causes the heart attack? Because our main objective here is to find out what causes this heart attack and what are the risk factors and what are the screening measure that we use in order to prevent the increasing rate of Filipinos suffering from this kind of illness. The most important here are the 4 chambers of the heart, which is the right atrium, the right ventricle, the left atrium, and the left ventricle. Why is it important? It's even dancing now. What is a heart? A heart is actually a hollow, muscular, size-of-a-piece organ located in the middle of your chest. If you know what's the size of your heart, you have to make a fist, and you put it in the middle of your chest. This is how the size of your heart gonna be. Except for you suffering congestive heart failure, where your heart will become more enlarged, much bigger than your piece. But for an ideal normal person, it's only as the size of the piece. That's how the size of your heart is. As I mentioned earlier, the 4 chambers of the heart, you need to be aware about those 4 parts, which is very important. And what is the function of the heart? It is the major components of the circulatory system. What is a circulatory system? As the word implies, it's help in the circulation of the blood. And how does it do those things? It consists of besides those 4 chambers, it consists of also of the veins and the capillaries and the arteries. Those help to transport oxygen in the different parts of the body and also nutrients at the same time. Okay. This is the circulation of the heart. And what happens is like this. How does the heart work? Is those blood that goes in your system, different parts of the body, coming from the upper part of the body and coming from the lower part of the body, they're going to meet in the right atrium. And after that, this is the right atrium, that one. They're going to go to this valve, go through past this valve and to the right ventricle, and go to the pulmonary system, go to the lungs. What is the significance of the color blue? It means there's no oxygen on it, or there's an insufficient supply of oxygen. That's the reason coming from there, going to the pulmonary system, going to the lungs, in order for them to remove the carbon dioxide and pick up the oxygen and some nutrients and go back to the heart. Through this one, going to the left atrium, going to the left ventricle, and going back to the aorta. Supply again the different parts of the body. Go back again after they use the oxygen, deliver those oxygen to the different parts of the system. They will go back again as being unoxygenated, or it means there's not enough oxygen, going back again all to the right atrium and to the right ventricle, and over again they're gonna
start all over again, going to the pulmonary system, going to the lungs, remove the carbon dioxide, pick up the oxygen and some nutrients, and go back again to the right side of the heart, left side of the heart, and then go deliver again those necessary supply which is needed by our body. See, I even make it animated so you will know what's the main purpose of it. So I'm not going to talk on more of these things because I already discussed it to you earlier. Actually, the circulatory system, I made a copy of the video so it will be more clear to you how does the heart, their function as a circulatory part, help in the circulation of the blood within our system, but it doesn't correspond with the computer. So I'm so sorry I was not able to show you the video. Right now, what I'm going to discuss to you is the major symptoms of the heart. This is the classic heart symptoms. Sometimes we just think it's just a heart attack. No, just chest pain. No, it's not. Most of the patients will complain to you, it's not chest pain. It's more of chest pressure. The way they will describe it to you is somebody is standing on top of my chest. That's how they describe to you. It's not just chest pain. And they even think that it's only the chest that hurts. No, it's not. Actually, you're having heart attack, but the pain is actually on your arm. It can be on the left or on the right arm, or even in the back, or even in the jaw. So it doesn't necessarily mean that the pain is on the chest, not on the chest. It's not a heart attack. It could be a heart attack because it will also include some of the major symptoms that I'm going to discuss to you, like nausea and vomiting, sweating. You will sweat a lot. There's pallor. Your skin will be pale. And there will be, you're going to be very anxious. Most patients will tell you, I don't know, something is going on. I really don't know. I can't explain. And why it's so hot in here? That's the major thing they're going to tell you. And they're having difficulty of breathing. You can notice the lips is becoming bluish too at the same time. Not only the lips, also their fingernails, their nail beds. Will be more clearer. What happened with the heart attack is like this. This is the coronary arteries, and this is the magnified version of the coronary arteries. If your cholesterol level is normal, it's gonna look like this. If you eat in Burger King once a week, probably it's gonna be like this. If you go to Burger King every day, you don't mind whatever food you're eating, it's gonna be like this. When the arteries is a black attack, you can see the narrowing and the opening of this. There will be an insufficient supply of oxygen or blood. Blood carries oxygen. So when the blood goes through the system, it's not enough. This is the coronary artery here. You can see there will be not enough supply of blood that can go through the coronary arteries that will cause, and as you know, the blood carries oxygen, and the coronary arteries supply this heart muscle. So there will be insufficient supply of blood, at the same time oxygen on this heart muscle. That's how you develop chest pain, or what we call the angina. Because because of the insufficient supply of blood on this particular area, of course, there's also insufficient supply of oxygen, and the heart will work more, and the patient will complain of chest pain. If, for example, it's been happening over time, you're not going to the doctor, you keep on watching TFC, you don't do your exercise, you don't watch whatever you're eating, okay? If the clogged artery will go after angina or chest pain, it will go to myocardial ischemia. Ischemia means the heart muscle start to begin. Okay? If there's already an ischemia, this particular area will not be getting enough nutrients because there's a blockage on that coronary artery. Because look at this. Pretty soon gonna block. This myocardial ischemia will turn to myocardial infarction. Myocardial infarction, or what we call cardiac arrest. You die. You're gonna die once you have. So those are the transition: chest, clogged arteries, chest pain, myocardial ischemia, and then myocardial infarction. So the purpose of the one that I'm discussing you is we want to prevent those things. That's why I will discuss to you the risk factors and the screening test that you have to undergo in order to prevent this. But I'm still gonna discuss to you about the stroke. What happened with the stroke? What is a stroke? Before I go to stroke, let me just go to you some of the treatment that we're doing in the hospital. I don't know if some of you are familiar with angioplasty. Nobody hear about anything about angioplasty?
I heard about it.
You got a pacemaker?
No, it's different. Okay. Angioplasty is, if for example you go to the hospital because you're having chest pain, the doctor gonna do this type of test to you. First of all, they're gonna do a blood test. The cardiac enzyme will be positive. We call it troponin. You're gonna manifest. What you're gonna complain to the emergency room are the signs and symptoms of heart attack that I'm showing you. They're gonna check your vital sign. They're gonna run some blood tests on you. Once the cardiac enzyme is positive, especially the troponin, they're gonna recommend to you the angioplasty. And what is angioplasty? This is the kind of treatment that we'll do if there's a blockage in the heart coronary artery. Okay? So how do the doctor gonna fix it? Okay? You can see there's an equipment that's being probed up to the heart, going to the coronary artery. You have to remember this. Most patients, unfortunately, a lot of Filipino are becoming our patient in telemetry, chest pain. The first thing they're gonna do, once they're positive with troponin, the doctor gonna do an angioplasty, or what we call cardiac catheterization. Okay? They're gonna go through your groin. They're gonna probe that, and they're gonna put an equipment. What they're gonna do is they're gonna insert it up to your coronary arteries. That's hard. Can you imagine they're gonna put some like a foreign instrument up to your coronary artery? That's kind of scary. You can see this. This is a clogged coronary arteries. If you can still remember the one that I showed you in the picture in the coronary arteries earlier, this is the magnified version. They're gonna put that probe inside, and that probe they're gonna inflate it. Okay, and that inflation consists of also a mesh. Once they remove this one, the mesh or the framework will stop. It stays there. Just for this, enable to improve the circulation on that particular area. Okay? Once they put a stent in your heart, you're gonna be on a blood thinner, Plavix, Coumadin, all throughout your lifetime. You don't want those things. Because if the doctor will not do this to you, and continue it having chest pain, myocardial ischemia, we want to stop it from there. We don't even want to go to myocardial ischemia. We just want it up to the chest pain, clogged artery, so they can still fix it. Because if they will not do it to you, pretty soon you're going to develop the myocardial ischemia and then the cardiac arrest, or what you call the myocardial infarction. Okay, and then you're going to be monitored. This is going to be hard because all throughout your life, you're going to take a blood thinner. Because this framework or mesh, is going to lead you to a clot formation, and that's no good. You know, we have to keep your blood thin because of the foreign object in your coronary arteries. Now we're gonna talk about stroke. Try to make it faster. Ate is already making beautiful eyes. Okay, this is a stroke. Okay. What is a stroke? If the heart attack, if the cardiac disease is what we call the cardiac attack, the stroke is what we call the brain attack. What happened? It's like in the coronary artery, there's a blockage. It cannot circulate the blood and distribute the blood in the different parts of the system. So what's going to happen in the stroke is this part, it's not in the coronary artery. This part is in the carotid artery. In this part, it shows the external carotid and internal carotid is somewhere here. You know the biggest vein in here. That's why when they have the stroke, they undergo what they call the endarterectomy. They remove that clot. Actually, they remove that clot. So, if you remove that clot, okay, you're going to be okay. But how about those parts in the brain that was not able to receive enough blood supply? Of course, once there's already an infarction on that particular part, it will manifest in you. Like, for example, if that area has been, it's just high blood pressure? No. Okay. That's the common symptom you're going to find with the stroke, the high blood pressure. You're going to see the first one. Besides having very, very high blood pressure, I don't know if it is Ate. Ate, are you the one who asked me to check your blood pressure? That's very, very high. Okay. You need to listen. Okay. We thought stroke is just due to high blood pressure. Okay. Actually, that's one of the major symptoms. But we don't want that, and not circulation in your brain artery. Why? Because you don't want to develop those aphasia or weakness or sludge pills from the stroke. This is when you call 911, when your blood pressure is so high and you cannot control because you're not taking your medication, when the 911 EMT people comes, the first thing they're going to do is they're going to check you with those symptoms. Okay? It's very easy to remember. It's fast. It's P for pace, A for arm, S for speech, and T for time. Pace. What are you going to notice with the pace? They're going to ask you to smile. Okay? Or they're going to ask you to say cheese. When they smile, they will notice there's a drooping on side of your mouth. Okay? This is one of the silent syndrome of stroke. Sometimes they're going to ask you to raise your arm. You raise your arm at the same time, but if you're having stroke, one of your arm will droop. No matter how much you try to raise it up, it's still going to be drooping like this. You cannot raise it at the same level. Okay? Your speech. You will not understand the way they talk. They could, no matter what they do, they cannot talk to you clearly. So I put the last one, time. Time is an essence. Why? When you notice those 3 symptoms that you're having, call 911 right away because it's very important. The time is so important. Why? When you go to the emergency room, they're going to give you a medication to keep your blood pressure under control. That's the main thing. Because in order to prevent the sequelae or the complication of the stroke lesser, okay, they're going to give you a thrombolytic drugs. A thrombolytic drugs is a blood thinner. The time is an essence because if you notice those silent symptoms that I show you, the sludge face, the drooping of the face, the weakness, you can reverse it if you go right away to the doctor within 1 to 3 hours. Because if you said, oh, this is nothing, I'll just gonna go to the doctor tomorrow. No, it's not so good. Because you cannot reverse them back. Because if the stroke sign and symptom of stroke was discovered in time, they're gonna send you to the emergency room. They're gonna put you on thrombolytic drugs, or what we call the streptokinase. That's a potent blood thinners. In order for you to reverse, I mean, so you can go back, your smile will be okay, it's not drooping, the weakness will recover, your speech gonna be clear. If not, you're gonna be in trouble. You're gonna have all those signs and symptoms for a while until they put you on a therapy. They're gonna see, it has to be administered within 3 hours of symptoms in case of ischemic stroke. They use, what do they do with you besides to confirm that you're having stroke? They're gonna do a CT scan. It's gonna show on the CT scan on the picture that I showed earlier that there's a blockage in your carotid artery. The patient will be anticoagulated. You're going to be put on the streptokinase if less than 3 hours. If not, they're going to put you on heparin IV. It's a blood thinner. It's very potent. The nurse has to be very good about it because simple mistake of calculation, you're going to bleed to death. But that's very potent medication. They're going to put you on aspirin, calcium channel blocker. Aspirin, you remember, I don't know what they said, it's better to take aspirin because it's, besides the antipyretic, the analgesic, the anti-inflammatory effect of the aspirin, it's also help to thin your blood. But just make sure it's recommended by the doctor. You cannot just take it because it can also predispose you for having gastric ulcer. It's gonna precipitate bleeding if it is not monitored. Just make sure the doctor prescribe it to you. But they said when you're on aspirin and you have the heart attack or stroke, the side effect is lesser. I mean, the complication is lesser. It's better.
Yeah.
But always ask your doctor first.
Instead of aspirin.
I think it's different, Ate.
It's different.
Ibuprofen is just more of anti-inflammatory.
Okay.
Aspirin, Ate, has an
It's not even
anti-platelet.
recommended.
So it's different.
Yeah, it thins your
It's
blood.
it's better to take aspirin.
Yeah, take aspirin because it's kind of thin your blood because it has an anti-platelet action
Yeah.
on the blood system. So, what are the coronary heart disease risk factors? Ate told me to give you all those
Yes.
copies.
Yes, and I think Lydia and Faye has been through this program. Of the six risk
I read
factors.
it.
We have here the high blood pressure.
They have the big book.
Yeah, big.
We have smoking is one of the risk factors, and cholesterol. There are 6, but we will discuss the others next week because diabetes is one of the risk factors. We also have weight control. What is the other one? Weight control, diabetes. What is the other one? Nutrition, physical activity. Yeah. So we will just discuss this, in the coming weeks. But we will just discuss maybe the 4 of them, today. But you should be aware that there are these publications. They're all in Tagalog.
Tagalog.
English, Tagalog.
English, Tagalog.
English, Tagalog. One side is English, then
Well, actually, we already gave you the handouts. It's part of them, but this is just the one that I researched. So, in the coronary heart disease, there's an increasing, there's about 80% of Filipino who died from coronary disease, 65 years or older. I think the part of it is, more, as you get older, there's what we call the atherosclerosis or hardening of the arteries. So you're going to be very, very prone with the stroke and heart disease because of, it's just the composition structure of your body as you get older. Okay? They said male gender, man has greater heart disease Increase the intracranial pressure within your arteries that predisposes the patient to having high blood pressure. That's why smoking, we really need to prevent it. If at an early age, the better, because but there's, it's still not too late to stop. If, for example, you have this habit of tobacco smoking, so it's just important for us to be monitored at the same time by the physician, because they could always prescribe some measure in order for help you to stop to smoke. High blood cholesterol. It's from the food that we're eating. I think in the handouts is also emphasized that we should be aware of what we're eating, especially pay special attention with the label, nutritional label, and the back of the food that we're eating. How much is the cholesterol content? How much is the sodium content? Because this will lead us having this heart and stroke disease if we're not going to watch our food. High blood pressure, I mentioned that earlier. Physical inactivity. In the hospital, even the patient just had the surgery, we encourage them to get up, walk, because it's when you're laying down in bed all the time, even us, just keep on watching TFC at home, don't go out, we just like to read or something. It's more of a sedentary lifestyle that's not gonna do good on us. Because as far as physical activity, it also help in the circulation. Because if you're stagnant, you just keep on sitting, watching television.
They're encouraging them to stand up, walk, even for a short while, maybe for the circulation,
Actually, the recommendation out there for physical activity is about 20 minutes 30 times a week.
Yeah.
20 minutes,
30
minutes is
minutes.
okay.
30
The 20 to 30 minutes.
Several times.
Three times a week.
Several days a week, yeah.
Those people that are very busy, the American Heart Association recommended them.
Yeah.
The least is 20, the most is 30.
It's 30.
As long as you do it 3
Yeah.
times a day, it helps in
Yeah.
the circulation.
Well, they said, the 30 can be broken up into 10 minutes
Yes.
each. You don't have to do the whole thing. Maybe 10 minutes in the morning, maybe 10 minutes, 10 minutes. As long as you have like 30 minutes in the day, you're doing something, exercising,
What if
You
you
said-
do it over 20
Yes,
minutes a
oh,
day? I
that
do,
is-
I do about half an hour every time,
yeah.
every day.
Yeah, that's...
They
even
said that
better.
it's the complication will be lesser if you do those
Yeah.
things. It's very important, not just watching your food, not just taking your medication, but also doing the exercise. But it said it's really make a significant effect if you
Yeah.
do those things.
Yeah.
Sometimes it's really hard for me because I was mentioning to Ate that I'm in the computer because I do my thesis. It's very, very hard because just like what you said, Ate, every hour or every 2 hours, I have to stand up.
Yeah, we have to.
You have
stand
to,
up.
or else your brain, your blood gonna be stagnant there, right there, and then it's not gonna do good,
Yeah.
especially if,
Yeah. Incidentally, the Tai Chi classes will be starting at Southwestern, and I'll bring the schedule. You can do it it's free. You can do it at the Bonita Library or the Veterans Home if you live in Chula Vista. It's Tuesday and Thursday and also Saturday. So you don't have to go to all the days, but maybe once a week. Tai Chi is really very good.
Obesity and overweight. Later on, I'm gonna talk to you about basal metabolic index. That's very, very important. And because when you're big, the more your heart gonna work more in order because they're gonna pump a lot of area, bigger area in your system. They're gonna pump more.
Yeah.
So you need to lose those extra weight, really. And besides, if you're not gonna keep your weight under control, besides having heart attack and stroke, you can also lead to diabetes. So that's no good. Okay. And diabetes, just like is also will predispose you to having heart attack and stroke. Other factors are stress. I think this is the number one, if I'm not mistaken. Probably can somebody share how can this be correlated with developing heart attack and stroke about stress? Could, is anybody wants to share something about stress?
If you're in love, that's stress.
So lack of oxygen.
Or probably when you have a problem with one who you're in love with, that's gonna be a stress.
Isn't it
Stress.
stress, your circulation level is not well?
Yeah. The stress is
Oxygen.
the
It's not-
stress is when you're under stress.
You're doing too much.
It can predispose you to having high blood pressure because the intracranial pressure within your system gonna work more harder. The more your blood can also cause one part of your body will develop those glucagon, the blood sugar. That's why it's not gonna only predispose you having heart disease and stroke. It will also predispose you for having diabetes at the same time. So for stress, you should.
Oh yeah.
I think
Well,
this is
we'll
part
do
of
more
it.
research, but I will look at the thing.
Yes,
because
Ate.
they are more careful about women
Yeah.
dying because they cannot detect whether they're having a heart attack or not.
Oh.
Yeah.
And they said heredity. Like me, my mom and dad died from myocardial infarction. So I'll be honest with you, when I reached 40, I tried to stop everything. But actually, the 40 is not a good age. As we go along, I'm gonna tell you exactly what age. Probably it's no longer applicable for us, but probably it will be applicable to the young generation. I will talk to you about that. And probably it's the genetic makeup. That's what I'm thinking. Why heredity is one of the factors for this, because you have a family history of high blood pressure. So those are the factors that.
Yeah. Of
If-
course, it's also related to diabetes.
Yes, Ate.
And diabetes is hereditary.
Mhm.
Like my dad, he has diabetes, and he really died of congenital heart disease.
Yes.
Yeah, so it's kind of coupled together.
Okay. That's number one. It's in your handouts too. And I think that smoking can really, my brother, I think, developed hypertension through
Through smoking.
smoking, and ended up having cancer and dying at an early age. I don't know, probably it's from the nicotine content that when it goes to your system, it increases the intracranial pressure within your arteries that predisposes the patient to having high blood pressure. That's why smoking, we really need to prevent it. If at an early age, the better, because but there's, it's still not too late to stop. If, for example, you have this habit of tobacco smoking, so it's just important for us to be monitored at the same time by the physician, because they could always prescribe some measure in order for help you to stop to smoke. High blood cholesterol. It's from the food that we're eating. I think in the handouts is also emphasized that we should be aware of what we're eating,
especially pay special attention with the label, nutritional label, and the back of the food that we're eating. How much is the cholesterol content? How much is the sodium content? Because this will lead us having this heart and stroke disease if we're not gonna watch our food. High blood pressure, I mentioned that earlier. Physical inactivity. In the hospital, even the patient just had the surgery, we encourage them to get up, walk. Because it's when you're laying down in bed all the time, even us just keep on watching TFC at home, don't go out, you know. We just like to read or something. It's more of a sedentary lifestyle that not gonna do good on us. Because as far as physical activity, it also help in the circulation. Because if you're stagnant, you just keep on sitting, watching television, your blood, the tendency of your blood is becoming more thicker than thinner. So the circulation will not be as fast as normal, as far as I know. That's why even in the hospital, we're trying to, besides anticoagulating them, giving them a blood thinner, we try to encourage them to get up, to walk. Or else their blood gonna be more isolated case. All you need to do is probably just go to a friend. Even she doesn't give any advice, just voice it out. Kind of help.
Well, in my case, I just purely don't want to stress myself. I just don't want to think about it. And once I think that I'm going to have stress, I just do something, exercise or anything. And I just don't. I don't know, that's me.
Yeah, that's a good way of, dealing with stress. Because everybody gets stress. But you have to learn how to cope with it. That's very important because even you do your exercise, even you follow the rules in less cholesterol, less salt in your food, even you take medication, if you're stressed out, that's different story. It still do a lot of things in your system. Even the adrenaline that we're talking about, there's some function in the kidney and there's a gland on top of the kidney out there. It produces that predisposition for produce more adrenaline, more high blood pressure you're gonna have. So the only thing that I like to emphasize here is you don't deal only with the physical contributing factor, you also deal with the mental or psychological aspect of the risk factor. Okay. Alcohol. What do you think alcohol? Rafi could answer that.
Yeah. Come on, Rafi.
When you're drunk, you don't know what you're doing. You just keep on eating high cholesterol and food and go different.
You drink moderately, it can help the blood flow.
I
right?
think it does. Ate.
Yeah.
Ate could answer that.
I think the one drink a day for women, especially red wine, they said would be good for the heart. That is moderately drinking is one serving a day for women, like an 8 ounce of glass. That's it. For men, it would be maybe 2, but don't go more than that, because more than that is really drinking too much.
Too bad.
I think, she's right. I think it deals mostly to with anatomical function. Oh,
Can I ask a question? They say that if you're drinking medicine, you're not to take alcohol. You cannot take alcohol.
Some medication out there, there's like a side effect interaction. It's usually when you go to the pharmacy, they'll give you that piece of paper or you need a consultation. It will state there on the brochure that they're gonna give you which medication have some drug interaction. Not all medication. That's why you need to, because what happened is, it's not really gonna make you feel bad. It's just it potentiate the action. As far as I know, the alcohol potentiate the action of
Yeah,
that
there's
medication, whatever you're taking.
Yeah.
Let's say you drink your medicine in the morning, then you take the red wine at night. Is that okay? Even there's no...
As long it's in the brochure, it said no drug interaction or that's not gonna be harmful if you take it with alcohol. Yes, why not?
Yeah.
Yes, why not?
Maybe just one
Because
drink in it.
as far as I know, the drinking, it causes coronary vasodilation. It's increase or improve the circulation within your system, as far as I know, as far as I can remember. So as long as it's moderate drinking, it's gonna be okay. And as long it's not written in your brochure that there will be no harmful effect. But most of the time, the harmful effect is just potentiates the action of the drug, whatever you're taking. The diet and nutrition. We'll talk about this
Yeah.
next
The week after
workshop.
next. Yeah.
So these are the next one will be the screening measure. I was quite surprised with this because I'm kind of late already with this. The blood pressure, when it's supposed to be checked, at least every 2 years, if blood pressure is less than 120 over 80. Every 2 years. It means if your blood pressure is normal. But for me, if I have a blood pressure problem, I'm not gonna wait every 2 years or every time that the doctors check up or every time I'm not feeling good.
Yeah.
Okay? When do you need to start? Age 20. I was surprised with this. I got this from American Heart Association and it was researched 2014. So I have an old one, but I want the latest one to show you. And that's how it is. So for me, I don't really follow this every 2 years. I will follow every doctor's visit if I'm okay. But if not, if I'm not feeling good, it won't hurt to have those battery-operated blood pressure at home. It helps a lot. Everything you feel something is going on, just check it out. It won't hurt. Okay. Cholesterol, they said every 4 to 6 years. This is, I think that we're talking about this is a individual who has a normal cholesterol, and it has to be checked at the age of 20. Because my kids, even they're 60 or 70 years old, I always take them the annual checkup because I got used with it. I kind of lessen it out, but at the age of 20, I'm gonna start again my daughter to go check this out. Because even my son told me when they eat, because I always separate my food with low cholesterol from the kids. Because you know kids, I don't really, not because I'm not really watching their food, but I let them enjoy their meal. Me and my husband know I have to limit because we're already on that stage that we really need to watch where we're eating. But for a normal person, it's 4 to 6 years. But if you're on you're on this stage, every time your doctor sees you, let them check it out. Okay. Cholesterol, as far as I know, when it's 200, it's okay.
More than
That
less
is
than
right.
200.
It's fine.
It's time.
Okay. When you're already between 200 and above and 239, you kind of watch it. Kind of watch. Start reading the label and whatever you're eating. When it's 240, you need an adjunct. I mean, some medication to lower it down. Some patients, they don't want it because when you take medication, there's always a side effect. But don't worry about it. If you always go to your doctor in your annual or whatever the doctor's appointment they tell you, they will check your blood. Usually some of the medication for blood pressure or cholesterol medication, it will affect your kidney and your liver. So they're gonna check those blood tests if it's still within the normal range for them, because we don't want those to get affected. Because the doctor means they need to adjust your medication dosage. That's the importance of it, that you really. Ate?
How about the others say that if they take medicine, they have cholesterol medicine, it's okay to eat and have that.
No, ate. It's like this. When you are, like for example, I just gonna set you an example, and you are on cholesterol medication, just like what Ate Lydia said, 200 is okay. No. When you have a cholesterol problem and you're taking medication, the normal range for you is around 90 only, because you're already taking medication. Okay? If you're already taking medication and your cholesterol is still above 240, the doctor needs to adjust your dosage.
Oh, I think
Because I
what
always
you
heard that if they take medicine, it's okay
No,
for
no,
them to
Ate.
have the high
Still.
cholesterol.
The doctor
That's
still
what
need
they
to
say.
check you. And for example, for the last 6 months or 3 months or 4 months, you're within the about a year, the doctor will decide whether to stop your medication or not. You just don't stop your medication abruptly without their advice. No,
Yeah.
you don't.
You know,
Because
that
it can
is,
always come back. It can recur.
That is so dangerous because I hear some people, I'm feeling better, you know.
Yes.
And I stopped my medication and I said, you don't stop your medication if you don't, even if you feel good. Because one time I had high blood pressure and that was the first thing I had while I was growing older, and I stopped because it was already normal. It went back. I had high blood pressure again, and it's even worse because after that, it doesn't want to go down anymore like it used to.
You're feeling good because the blood pressure medication was
Controlling
controlling
at
your
that
blood
time.
pressure.
Yeah, yeah.
So it's okay. Go ahead. Don't stop it. because
Yeah, I
it's
did, but I hear
definitely-
a lot of people, and so I told her, don't stop your medication just because you feel good. You don't. You continue.
Because because
Medication.
most of our patients, they come back. We call it frequent flyer. Most of them, the major reason in the hospital is non-compliance with the medication. Because I don't need it. My blood pressure is normal already.
Yeah, yeah.
And when they come back, it's a curse. It's more worse.
It's
If your
difficult.
blood pressure before is 160, 180, it's gonna be 200 by the time you come back
Yeah.
to the hospital.
Yeah.
So we emphasize that you don't stop your medication without the doctor's advice, even you feel better.
Yeah.
Okay. Some patient will also tell, Rosa, I'm already dizzy. Why don't you check your blood pressure? If your blood pressure is lower than 100, it won't hurt to skip the pill just for that day or just that morning. Okay? Unless your blood pressure is normal. Because I always tell, because some blood pressure medication could also causes your heart to go down more. A normal heart rate is 60 to 80. When it goes down lower to 60, it's okay to skip one, but make sure again, you check it again in the evening. If it goes up, then you take it. Okay? But you need to, because some blood pressure medication has some side effect of lowering it too low, or the heart rate, lowering down the heart rate too low. So it's very important that $50 blood pressure battery operated machine to be at home. Because especially if there will be, you don't have any relative that is, can help you out to check your blood pressure, that will be a big help. Weight and BMI. I've been trying to figure out the calculation. I wish Sarah's here. Ate probably knows. The BMI, the normal is, there's a calculation of your height and weight. Last night I was checking it and then I got sidetracked with what I'm doing. So actually the normal BMI is about 20, you don't go up more than 25.
25, yeah.
So 25. When you're 25 and below, you're normal for your height and weight.
Yeah.
When it's above 25, they will classify you with your obese or overweight.
Yeah.
So
Actually, there's a table, and I think Sarah will discuss
yeah,
it.
she will discuss.
When we go to nutrition, we have a table that we can give to you. So you just look at your height and your weight, and it will tell you whether you're overweight.
What's your
underweight,
BMI?
or-
That's very important. That's
Yeah.
when you go to the doctor, they'll check your BMI at the same
Yeah.
time, so they'll tell
Yeah.
you're overweight.
Yeah.
The BMI also consists of the waist circumference. They also said that you need to start checking it at the age of 20.
This one is important. The waist circumference is really important then.
They said the blood glucose has to be checked every 3 years, if that is normal. When to start? At the age of 45. But if you're not on a normal range, it's better not to wait for at least 3 years. Okay? No. If you know that you are on pre-diabetic stage, you need to be checked out. Even just go to a center or during your doctor's visits. It's very important. Discuss smoking and physical activity, exercise. We already discussed this earlier, the importance of smoking. If you're having problem with how to stop smoking, you need help, professional help. There's a lot of things you can take nicotine gum. Some patient we use is a nicotine patch, and some yoga exercises. I don't know how yoga gonna work, but it does work for like a relaxation technique in order to relieve from smoking. And increase physical activity. They also said to, I think that's it. Any more questions?
Pwede akong kumain ng,
Okay.
what do you
Are
call
you
that?
done?
Kasi I'll take my cholesterol.
Let's give thank you very much. And we just want to let you know that we have a program, the Healthy Heart, Healthy Program, and we have taught that once already, and according to our evaluation, this program works because people who take this, their knowledge about health has increased. So it's really a proven, they have tested it. I have extra manuals, Emma, if you're interested, and a lot of handouts that go along, so you can use it, for teaching.
Yeah. You tell me about the big
Yeah.
folder.
We have the flip chart also.
Yeah.
So you don't have to do a PowerPoint. You like Joanne, you can go through the flip chart and talk about heart disease. Yeah, I have. So before you go, let me know and I'll give you a manual, and you can get some of these handouts and
Okay, let's
publications.
give a big hand to.
Thank you. So, did you have any other
I'm
questions?
sorry, this is the first time I
Very good job.
demonstrated.
Good job.
I'm so sorry.
Well,
I
you
gotta.
did very well.
I really
You did
apologize.
very
No,
well.
I'm not used with it. I'm just used with the hospital giving health teaching to the patient.
One-to-one.
Pretend we are your patient.
One-to-one.
So, did you have any questions about heart disease or cancer that
Yes.
is not so clear, or whatever you want to share, Lydia? What you have done with the Tuma Park? I know you and Faye.
That's been so long.
Yeah, that was
some
just a
of
year
them-
ago.
No. It's
One
been
or
a year.
1.5 year ago.
The class is, we had a hard time teaching the people
The
there because,
seniors?
seniors, because they
Yeah.
knew too much, some of them. But we did,
Yeah. There's a pre-test and a post-test for this
this
program.
program.
So if you want to test their knowledge before and after, which we did, and then we look at the data, it was significant.
Yeah.
The knowledge that they obtained, the knowledge was significantly changed, but not their behavior.
The behavior is
The
right.
behavior, it will take a long time, to change that.
Right.
But see, the knowledge, they are full of knowledge, but whether they are practicing what they have learned, it takes a long time to be able to determine that. Yeah.
Well, I have a neighbor, she's 93 years old. She has mastectomy, both breasts. She had an accident 2 weeks
Who's
ago.
that?
My neighbor,
Oh,
Betty, had an accident,
car accident?
car accident. Her car was totaled, but she said her prosthesis protected her. It was so funny the way she described it.
Really?
Yeah.
You mean she has
She had the
breast?
breast, no,
implant.
implant in the boobs, the artificial boobs.
Really?
That protected her from the steering wheel. I said
From
that
the
she,
balloon.
yeah,
Oh, my goodness.
from having a rib. It was so
Yeah.
funny when she,
Prosthesis,
yeah.
Well,
She
that's
bought-
the
that
thing
was it.
also with the newer cars. Newer cars are actually made to be safer. You know, although maybe they are so fast that
Yes.
the possibility of having an accident is so great. And I read in the papers that more people are dying from car accident. And once I'm in the highway, I just notice how fast.
I know.
You know, I have a phobia.
Okay.
Driving, they drive so fast.
Sometimes
they all
I have a
Testing.
I have some gallbladder disease and heart chest pain are the same symptoms. So if you have a gallbladder, sometimes
Oh,
you
I
know, oh
see.
no, it's my gallbladder acting. It's not my heart, but they have the same symptoms. So don't ignore
really?
it. Yeah, it could be your heart, it could be your gallbladder because
Oh, I
it's
see. So they have the
yeah,
same
the same
symptoms.
symptoms. Yeah.
I just want to add something out there in regards to Joanne, because Mr. Sim asked earlier, once the cancer has been removed, can it come back again? Actually, I think that's the main reason why preventive care is very important. Because
They
like the
will.
cancer that she's talking about, if it is discovered early, 1 or stage 1 or 2, once it's surgically removed, the prognosis is good. Once it's been discovered 3 or 4 and 5, that's it.
There's no chance of.
And they die.
Even they put you on chemo, ate.
Oh,
You
really?
still, so it depends. And another thing that I wanna add to what she said, it depends on what kind of cancer, what type of cell. There's what we call the non-cell
I'm not too
carcinoma
good,
and the small cell carcinoma. So I think the non-cell is more very aggressive.
Yeah, yeah.
Like for example, you've been discovered only October, you can die in by
If
January.
it's
It's
fourth, yeah.
fast.
Because
Yeah.
we
So-
just buried a wife of one of my member. God, it was so fast. Stage
It's
4.
fast.
She died. Yeah.
Yeah.
So
Not even 6 months. Yeah, she died.
I know of somebody, she's like 31 years old, mother of 2. They're suing the doctor
Oh, really?
because it turned out that when she had breast implant,
breast
they
implant.
already found that there's something there, but they continue with the
Oh,
breast
that's not
implant.
good.
With the what?
They continue
With the
with
implant.
The implant.
With the implant.
The
but she
breast
had a.
they already saw that there's some,
Some
Cancer.
cyst,
yeah.
and they
And then
continued with the implant.
So they're suing the,
Oh, so you mean they should have treated it first?
yeah, or they
Oh,
should have notified, or they should have
Yeah,
not
it's
stopped,
it's a policy, ate. Because before you put an implant on a patient, you need to check their risk factor. If they already discovered that she
I think
already
they-
had a cyst there,
Yeah.
might as well take care of the cyst first if she really wants the implant.
Yeah.
But what they did, they
Yeah.
did the
just
implant
did it.
right
That's why
away.
they're suing the.
So what did
doctor,
she
yeah.
do? She's suing the doctor.
She died already.
Huh?
Oh, yeah.
She died already.
She died.
Oh,
She
she
gonna
already
die.
died.
Yeah,
be-
so the family is suing. Very
Oh.
complicated.
Oh.
She didn't even tell her
Yeah.
mother that she had breast cancer.
Oh, wow.
So when her mother in the Philippines, a doctor who used to live here, found out, it was only when she's dead. So that's another story, you know.
Yeah.
Oh,
So